So, what is community-driven development? There are many definitions, but the definition that we used is one where the community is in charge of its own development. So the community is in charge of selecting, implementing, and maintaining its own projects. So as part of our review, we looked at projects that mainly focused on public infrastructure. So CDD does fund private goods. So there are programs that, for instance, offer cash transfers. But we thought that as part of our review that those are different kinds of programs. So we decided to only focus on programs that looked at public infrastructure, which means building schools, roads, rehabilitating health facilities, water facilities, and so on. There's been a considerable amount of investment in CDD. The World Bank alone supports over 400 CDD projects in 94 countries, and it's valued at $30 billion. Every year, $1.3 billion is invested in CDD. There are other funders. There's DFID, IRC, but they've been investing mainly in conflict-affected countries, so DRC, Afghanistan, and so on. So there's considerable amount of investment in CDD. The question is, does it work? And more importantly, what does it work for? So we decided to do this review, and so the programs that were included in this review were those that had impact evaluations, those that involved the whole community, that devolved financial management to communities. And this is extremely important because there's several community-based development programs where the community doesn't manage the finances, and this is a crucial difference. Programs that offered projects that benefit the whole community, so it's not targeting specific groups like women or the youth. Offered a multi-sectoral menu, so communities could choose different projects, but where the emphasis is on public infrastructure. We did what we call a mixed methods causal chain synthesis. It sounds very technical, and I explain that. We not only drew on impact evaluations, but we also drew on process evaluations and qualitative research. I'll explain what causal chain is a little bit later. So we started out as a rapid review, but it ended up not being very rapid because it became very extensive in terms of drawing on process evaluations and qualitative research. I'd like to acknowledge my co-authors, Howard White, he was the lead author of this paper, and Hugh Waddington, who's in the audience here. So in terms of search strategy, we tried to apply some systematic review principles, but it is not a systematic review. We looked through reviews, journals, academic databases, and of course used some snowballing, looking at references in existing papers. And with this method, we identified about 25 impact evaluations of 23 programs in 21 countries. And out of the 23, 5 were in post-conflict countries. Which included DRC, Sierra Leone, Afghanistan, Aceh in Indonesia, and Nicaragua. So what we did was content analysis of some of these project documents that we looked at, and we tried to see how these programs have evolved since the 90s. And so you can see that in the 90s, the emphasis was on poverty reduction and creation of public infrastructure. But as you get into the 2000s, you see that there's more of an emphasis on decentralization and improving governance, and particularly improving social cohesion. And you see that particularly with the long-running programs where this shift happens. And you see that in the naming of these programs as well. So what started out as the Keka Martin Development Program turns into the Community Empowerment Program. So you see that in the naming of the programs as well. So this is a highly simplified version of the theory of change of CDD programs. So here it's important to differentiate between two kinds of CDD programs, those that follow the applied model and those that follow the application model. So allocation and applied model, sorry. So the application model is where communities are expected to apply for funds, and the allocation model is where implementing agencies choose certain communities for receiving those funds. And that's a crucial difference, because if you're required to apply, then the implementing agency has to carry out awareness activities. There's training and facilitation provided for community participation. Community participates in projects, and this leads to a public good being created, public infrastructure is created, and the assumption is that it leads to an improvement in welfare outcomes. And this entire inclusive process of community participation, one expects that the community learns by doing, and this leads to an improvement in social cohesion and governance. Now, there are numerous assumptions that are underpinning this theory of change. It's one of the most complex theories of change. I won't go into it because we'll be here all evening, and I don't want to torture you any further. But Here is going on to then the overview of the findings. So this is what we call an evidence matrix. So what we did was we plotted the evidence along this matrix across different sectors. So you can see WASH, health, education, and then across the causal chain. So activities that are carried out, this is the earlier part of the causal chain, and then training provided to communities, and then how does it affect the creation of facilities, access to facilities, and then finally intermediate and final outcomes. And what you see is that definitely across sectors, there's an improvement in facilities. And you see this in all of these sectors. And why is that? So just looking at the documents, and of course we did meta-analysis, which also shows that there's an improvement in outcomes, but just looking at project documents, you see the sheer scale of CDD projects. These are like in the hundreds and the 100,000s. So in terms of scale, it's massive, and most CDD programs exceeded targets. So it's no surprise that CDD improved facilities because it really did create a lot of, improve the quantity of infrastructure. But then, when you start to look across the causal chain, you see that CDD, so I didn't explain this properly, but the green stands for a significant positive effect, the red stands for no effect, the blue stands for areas where there was no data, and the gray is just not applicable. So you see the red boxes across education, so you see that CDD doesn't really improve access, intermediate, or final outcomes in education, but one can't expect it to, because if all it did was rehabilitate schools and the focus was on public infrastructure without any other complementary inputs, and we know that from our own systematic review in education that if the complementary inputs don't address the fundamental barriers to education, you can't expect it to improve enrollment, attendance, or learning outcomes. You do see some slight improvement in health outcomes. This is not entirely surprising because the focus is on rehabilitating health facilities, providing medicines and doctors, but also some of the health effect comes from rehabilitating the water facilities. So it's well known that if you do improvement in wash facilities, it may lead to a reduction in diarrhea, and so there is some effect on health outcomes. Finally, in terms of water, so you see that the rehabilitation of water facilities leads to an improvement in access to water, but it also leads to a big reduction in time savings. So you spend less time collecting water, and so that's a pretty significant effect. Finally, moving on to social cohesion. So this is what we call a forest plot. And I like to think of it, not missing the forest for the trees. So you get the big picture. And so if you plot, so the studies are plotted along here, as you can see, different countries. The horizontal line is the confidence interval, and the vertical line is the line of no effect. And so as you see that the studies, as you see the effect size closer to the line of no effect means that those programs don't have an effect. And you see this, there's no heterogeneity. So there is absolutely no variation. All of them are just stuck to the line. And there is a diamond, I promise you, at the bottom, but it's just so much with the line that there is no effect. So basically what it means is that CDD programs have no effect on social cohesion. A lot of papers say that further research needs to be carried out. This is an area where you don't need further research because all of these studies say so. The same goes for governance. There seems to be no improvement in governance outcomes, and even using elections, where you can see there's been analysis carried out on, what happens to those programs where a committee is elected, so more democratic techniques, but again, there seems to be no effect. My colleague Hugh Waddington can answer more technical questions on the meta-analysis. And this effect is across the causal chain, so you see across here, there is no effect on social cohesion. So why is it that there's no effect on social cohesion? And borrowing one of my lead co-authors, Howard often says this: people participate in making bricks, but not decisions. So one of the big assumptions in CDD is that you expect the entire community participates in the program, but does that happen? So what we did was we took all of the participation data that we could find from the different documents, and we plotted it on this graph, which we call the funnel of attrition. So you see that many people would have heard of the project. Some would be aware of the meeting that is taking place, but few attend, and then fewer still speak at the meeting, and then very few are even aware of the cost of the project. So this whole assumption that the entire community participates in the project doesn't hold. So what are the reasons for limited community participation? First of all, we find that community decision-making can often be led by the elite or the prime movers in the community. And I'll get to that a little later, but there are other things. Often the definition of a community is a geographic or an administrative one. And there may be many groups within the community. So for instance, in Yemen, there were tribal and ethnic groups within the community, and they couldn't come to an agreement on the location of where the services had to be provided, and there was a great amount of conflict. Similarly, in Afghanistan, different ethnic groups were clashing. And so this is the danger of using a very geographic administrative definition of a community. Programs create parallel structures, and you find this with community-driven reconstruction programs where there is, the program implementers come in, create a new governance structure, which challenges or threatens the existing traditional authorities, and this causes friction, and it just doesn't work. The perceived benefits of participation. So interestingly, one of the project documents, this was in St. Lucia, I think, where the community, they found an interesting trend where the community members would participate, like a household would participate in the construction of, like, for instance, a footpath, if it's outside their house. The minute the construction was over outside their house, they were done. It's not surprising. I mean, I would do the same. But also other factors like continuity of funding. So when communities, long-running programs where the funding is continuous, the participation increases over a period of time. So perceived benefits of participation. And finally, facilitation. Where external facilitation has been provided to improve participation, you do see an increase in number of community members coming to meetings. So an important question that we wanted to ask as part of this review is, do CDD programs promote equity? So we drew on impact evaluations, but impact evaluations didn't give us an answer to that. But some of the process evaluations and qualitative research helped us build a picture of what different program elements that may be influencing who participates in the program. So there's targeting, there is facilitation, all of that, how it definitely influences who benefits from the program. There's geographic targeting, so a lot of programs use geographic targeting methods like poverty maps. So it may lead to a better allocation of resources to poorer areas, but not the poorest within those areas. The application model, so you find that the elite take charge because you have to apply for the program. So those who have skills would put together a proposal, they may use their status, wealth, or education to influence community decision making. So teachers in Zambia, for instance, took a lead role. And not surprising, a lot of the funds went to school rehabilitation, so it's not surprising. CDR programs, the targeting can be quite a sensitive process where you label conflict-affected people or ex-combatants, and it can cause friction. So there's very little evidence on how targeting influences who benefits from the program. Community contribution, and this is a very key design element that you see across CDD programs. So communities are required to contribute 5 or up to 50% of the project cost, and that's quite significant, and it could be in kind, in cash, or in terms of labor. But, I mean, the idea is that it builds ownership, and the unit costs of projects where community contributes can be quite low. But contribution, this requirement can again bias allocations towards better off communities because they are in a position to contribute. So for instance, in Nigeria, the poor community members used to get into rental agreements with richer community members to just make the contribution. Sometimes projects for women and the vulnerable just did not take off because they could not make the contribution requirement. So more evidence needed on the contribution requirement, but it's clear that it definitely biases allocation. Finally, looking at approaches used to increase women's participation. Now, facilitation is something that's really key with community-driven development programs, and it varies in terms of intensity and who provides the facilitation and so on. You have no evidence on how facilitation influences the participation of the vulnerable, the physically challenged at all, or ethnic groups. There's some bit of information on how facilitation improves the participation of women. For women, there are additionally program rules, for instance, having a quota system, so a certain percentage of the project committee has to be women, so there are rules like that. But few studies show, existing studies show that mandating the inclusion of women in project committees and does not really help in increasing participation in the short term. So in DRC, where there was this quota requirement, you find that there was no difference between the control group and the treatment group. It's just the quota requirement didn't make a difference. Women still accounted for 30%. In Afghanistan, where women were supposed to be involved in project selection and elections, the men were controlling some of the voting decisions. So studies really don't capture the quality of participation and how it affects women's empowerment and whether women take on a more active role in the public sphere beyond the scope of the project. So this is, again, just a funnel of attrition for looking at women's participation, but women, so women are only half as likely as men to have heard of the program, and then the same kind of funnel of attrition operates that fewer attend the meeting, speak at the meeting, or are on the project committee. So as expected, there are several gendered, cultural, and socio-economic factors affecting women. I don't need to explain that. This is something that everyone knows. There's the opportunity cost of attending meetings for women. There's illiteracy. And so there's numerous barriers to women's participation. But ending on a positive note, there are some programs that have a really comprehensive approach to increasing women's participation, and these are some of the longer running programs. So they've had separate meeting invitations to women, one proposal coming from a women's group, intense facilitation to improve the participation of the more marginalized women, appointment of women as facilitators, and 50% of representation on every village delegation being women. So this is a comprehensive set of measures. So finally, in conclusion, CDD programs, we really think that in terms of the objective of building social cohesion, we need to reconsider that. They don't improve social cohesion. And also, let's look at the definition of social cohesion. If the definition is in behaviors and attitudes that reflect the propensity to cooperate, it's really not clear how this inclusive process of community participation leads to an improvement of social cohesion. There's various kinds of social capital. So there's bonding social capital and bridging social capital. So bonding implies more cooperation and trust within the community. Bridging is faith and the connectedness to local authorities. But if people come together, they're more likely to complain about the people in charge. So this is something we see. So, and how do we sort of address the issue of intergroup social cohesion and cohesion within the community? So differentiating between those different aspects of social cohesion. We really ought to revise the definition of a community as a geographic administrative unit, and we really ought to think of the different program elements that influence participation. So targeting, community contribution, facilitation, all of this affects community participation, and we need to look at the mechanisms that can ensure the sustainability of infrastructure. Previous reviews have talked a lot about this, but we've still not learned from this that we need those mechanisms. So how our community is able to handle issues of maintenance of infrastructure, for instance. Finally, my last slide. In terms of implications for research, future studies really need to assess the political economy of decision making, factor in issues like what is participatory governance, an integral part of the existing political system, and if so, how inclusive is it? We need to widen and sharpen the focus of impact evaluations, looking at size of grants, for instance, or how long there was training or facilitation and all of these elements. And look at cost effectiveness. So an important area of further research is comparing CDD with other alternative delivery mechanisms. So how does it compare in terms of costs? And we need a more equity-focused qualitative research and process evaluations, because they really help you delve into the why question and the how questions of how these programs work. So CDD is a proven approach for building small-scale infrastructure. It should not certainly be discarded as a fact, but we do need to reconsider the social cohesion objectives, and we do need to think about the designs of CDD programs so they really deliver on equity. Thank you.